Welcome TRS retirees and families. This presentation today is going to cover your TRS-Care Medicare Advantage plan. That's healthcare that TRS meticulously crafted for you, our retired public school employees who are on Medicare or eligible for Medicare. TRS-Care Medicare Advantage provides your medical coverage. This plan also includes pharmacy coverage, which we call TRS-Care Medicare RX. Here at TRS-Care, we know healthcare is not a one-size-fits-all, and that's why we offer comprehensive medical and pharmacy coverage. We tailor that to your unique needs. Today, our mission is pretty simple. We want to engage in meaningful dialogue with you. We want to address all your questions, empower you with knowledge so you can leverage your care benefits to your fullest potential. Also want to note that if you're retiring from a Texas higher education institution, and you qualify for a TRS retirement pension, your retirement health benefits may come from ERS, UT, or Texas A&M. So you might want to check with your employer to see if you're eligible for those benefits. And if not, you can enroll in TRS-Care. For those of you who are new to webinars, let's review a few housekeeping items before we start. All participants will remain on mute during the webinar. If you don't see the handouts panel, select View Handouts in the top menu bar of the control panel. You'll want to take a moment to check your settings. You'll want to email us if you still can't see the handouts. And during the webinar, you'll want to submit your questions through the questions box on the GoToWebinar panel. We have subject matter experts who are here to respond to your questions throughout the meeting. And please don't post confidential information in the chat. We have thousands of registrants on for the event, so we don't want to get your question in the mix. So you'll want to call us or email us. And once we get to the Q&A session at the end, we'll respond live to frequently asked questions. If you have connection issues on GoToWebinar, the software we're using today, go to their support website listed on the slide. You can also download the link in the handout section. You'll want to look for the handout called TRS-Care Important Contacts. In addition to connecting with you on this virtual event, we're excited to be on the road this fall with you and your health care carriers. We'll host a series of in-person health education fairs across Texas through October. And if any of these events are on this slide or at a location near you, come on over to our events webpage to register. You can download the link to our healthcare events webpage in the handouts section. You'll look for the handout called TRS-Care Important Contacts. You'll want to make plans to speak to us in person about your 2025 benefits. We hope to see you soon. All right, well, today we're going to talk about your 2025 TRS-Care Medicare Advantage plan benefits. And we'll give you a chance to hear from TRS, United Healthcare, and Express Scripts. First, you'll hear from United Healthcare. They administer your medical benefits with TRS-Care Medicare Advantage. Next, you'll hear from Express Scripts. They administer your pharmacy benefits for TRS-Care Medicare RX. All right, well, let's go ahead and move forward. So what's new with TRS-Care? 2025 is no ordinary year for TRS-Care Medicare Advantage. After years of no changes to TRS-Care, we're thrilled to bring you something special in 2025. To start, I want to take a moment to thank the Texas Legislature for supporting our Medicare-eligible population in TRS-Care. A healthy, strong TRS-Care fund balance and recent federal changes to Medicare, along with TRS's careful plan management and other factors, have allowed us to maintain the long-term stability of the TRS-Care fund. And we do this while making positive changes to TRS-Care Medicare Advantage. So we greatly appreciate the legislature's backing of these two amazing changes that are starting in 2025. And one of these changes is that TRS is lowering TRS-Care Medicare Advantage premiums for the 2025 plan year. In future years, we'll need to determine limited increases based on market trends and rising healthcare costs. Another great change is a limited time enrollment opportunity that allows Medicare-eligible TRS retirees to enroll in or rejoin TRS-Care Medicare Advantage. You may also add your dependents when you enroll, You can enroll from October 1st, 2024 through March 31st of 2026. And with this opportunity, your TRS-Care Medicare Advantage coverage effective date will be the first day of the following month TRS gets your completed and approved application, but no sooner than January 1st, 2025. So eligible TRS retirees and surviving spouses can use this chance one time to enroll or re-enroll. We're also excited to announce dental and vision benefits for retirees and their eligible dependents that are coming to TRS Care in 2025. You don't need to be enrolled in a TRS Care health plan to enroll in TRS Care Dental and TRS Care Vision. This includes TRS retirees, their dependents, surviving spouses, and surviving dependent children. Enrollment is from October 1st through December 7th, 2024. Coverage starts January 1st, 2025. You'll want to look for updates in our healthcare newsletter, The Pulse. You can subscribe to that at the TRS website. All right, premiums have remained in place for the past 7 years. So those are some reasons why we are making these changes. There's a growing fund balance. There are federal changes to Medicare benefits and funding, and TRS's thorough plan management. Plan year 2025 was determined the right time for premium reductions because of the uncertainty of the pandemic has now passed. Rate adjustments get us closer to market rates, and Medicare changes have been made over the last several years. Medicare regulation and program changes are dynamic, so these need to be reviewed annually to manage benefits, pricing, and alignment with the market. In future years, we'll need to determine limited increases based on market trends and rising healthcare costs. I want to expand on the exciting news about lower TRS-Care Medicare Advantage premiums for the 2025 plan year. As you can see from this table, the decreases are significant. The table compares retiree health plan costs for the 2024 and 2025 years across the different coverage categories. Please take a look at the last column for the most notable points. Retiree only cost decreases by $60 from 2024 to 2025. Retiree plus spouse cost decreases by $249. Retiree plus children cost decreases by $60. Retiree plus family decreases by $407. And we are thrilled to share this news with you and pass along these cost savings. In future years, we'll need to determine limited increases based on market trends and rising healthcare costs. Now I'll pass the baton on to United Healthcare, who will review your TRS-Care Medicare Advantage plan benefits, programs, and features.
Thank you, Christina. Hi, my name is Lacey with United Healthcare. Thank you for the opportunity to speak to you today about the benefits and programs available to you through TRS-Care Medicare Advantage. Today, my goal is to ensure that any question you may have regarding your medical benefits are answered, and you're provided with additional clarity and understanding of many offerings within your plan that we hope you take full advantage of. So let's get started. Your TRS-Care Medicare Advantage plan will cover all Medicare Part A benefits, which includes inpatient hospital, skilled nursing, and home health, and will cover all Medicare Part B benefits, doctor's office visits, outpatient care, and labs, as well as offer additional benefits and programs beyond original Medicare. Your TRS-Care Medicare plan also covers Part D prescription drug coverage that will be addressed later in the presentation. Please know, you will continue to retain all the rights and privileges of Medicare, but your medical benefits and medical claims will be processed by United Healthcare. Also note, you must continue to pay your Part B premium. If you stop paying your Medicare Part B premium, you risk losing all TRS care coverage. Everything covered under original Medicare must be and is covered under your TRS Care Medicare Advantage. There are many terms within your plan that are important to know and understand. I'd like to talk about the most important and most commonly asked about. The first we'll discuss is the deductible. So what is the annual deductible? This is the amount that you pay for health care before your plan begins to pay for your benefits. If you are aging in from the TRS-Care Standard Plan to the TRS-Care Medicare Advantage Plan in 2024, you will have a $0 deductible for the remainder of the calendar year. For 2025, you will have a $400 annual deductible. What is a copay or coinsurance? It's once you've paid the $400 annual deductible. If applicable, you may pay a copay or a coinsurance depending on the services provided. A copayment is the fixed amount you're responsible for paying, and coinsurance is the percent of the amount the allowed amount you would pay after the deductible is met. Another term within your plan that is important to know and understand will be the maximum out-of-pocket, which is the most you would have to pay for services covered by a health plan, including deductibles, copays, and coinsurance. If and when you reach your annual out-of-pocket limit, the TRS-Care Medicare Advantage Plan will pay 100% of the Medicare-approved amount for most covered medical charges. TRS-Care Medicare Advantage lets you see providers in or out of United Healthcare Network for the same cost to you as long as the out-of-network provider participates in Medicare and is willing to bill United Healthcare. The provider you are currently seeing may already be in the United Healthcare Network under your plan. To confirm if your provider is in network, you can check online or call the dedicated TRS-Care customer service team. If your doctor is in network, they must accept this plan if you are an existing patient. If your provider is not in the United Healthcare Network, our customer service team may be able to assist by confirming if the provider participates in Medicare and accepts the plan. We have a huge 2025 enhancement for the TRS-Care Medicare Advantage. Currently, members have 4 separate cards provided by United Healthcare: your medical card, your over-the-counter benefit card, your house calls card, and your rewards card. In 2025, we will merge all cards into one secured single card that we refer to as U-Card. The U-Card will house all of your earned rewards, your over-the-counter reloadable benefits, and will serve as your medical card that you can use to check in at any network provider, office, or pharmacy. You can make purchases online or in the store using earned rewards dollars and access participating gym facilities using your Silver Sneakers benefit. The card will have a 16-digit card number, 3-digit security number on the back, and an expiration date. Starting in October through December, members, both new and existing, will receive a U-Card with details on how to activate your card, how to utilize it, and how to access both the website and the mobile app to familiarize yourself with the new features of this card. As I mentioned previously, with your TRS-Care Medicare Advantage PPO plan, you will pay the same amount for in and out of network for care. If we review some of your plan benefit highlights, you would note that regardless if the provider is in or out of network, your member cost share does not change. Let's look at a few of the benefit coverages. A primary care office visit will be covered at a $5 copay. A specialist office visit will be covered at a $10 copay after the deductible. Urgent care visit at a $35 copay. Emergency room at a $65 copay. Inpatient hospitalization at a $500 per stay after the deductible. Outpatient surgery has a $250 copay after the deductible. And medical virtual visits will be a $0 visit using Amwell, Doctor on Demand, and Teladoc. Let's continue on with additional coverages. Outpatient laboratory services at a $0 after the deductible. Physical therapy at a $5 copay after the deductible. Outpatient radiology services, durable medical equipment, and chiropractic services as a 5% coinsurance after the deductible. Next, I would like to discuss preventive services. You may wonder what is the difference between a preventive care visit and a diagnostic care visit. Well, a preventive service is intended to prevent certain illnesses and diseases. Receiving preventive care is a great way to help you and your loved ones remain in good health. A diagnostic service is intended to identify the nature and cause of an illness or other medical concerns, along with the method of treatment. Your preventive services are available within your plan at no charge. Let's switch gears here a bit. Within your plan, you have a list of value-added benefits. Value-added benefits are additional benefits within your plan at no additional cost, and benefits that I hope you take full advantage of. Healthy Benefits Plus is you have a $40 allowance every 3 months to buy over-the-counter products. This allowance can be rolled over from quarter to quarter, but not annually. There was a huge 2024 enhancement. Members now get the allowance on the debit card that allows them to make the purchases in store at large retailers. Over-the-counter products includes Band-Aids, vitamins, walking canes, and more. Moving into 2025, this benefit would now be preloaded onto the U card that I discussed earlier. Routine transportation provides you with 24 one-way or 12 round-trip rides per year up to 100 miles to and from medically related appointments and pharmacy trips. In-home personal care, it allows you to receive assistance with daily activities such as laundry, mopping, organizing, watering plants, and more. This benefit provides you with 8 hours a month of non-medically related care. Silver Sneakers. This gives you access to a free basic gym membership at any participating Silver Sneakers location and access to group exercise classes and online resources. And lastly, a hearing benefit. You have a $0 copay for an annual routine hearing exam. Plus, you have access to a hearing aid fitting and choice of a wide selection of hearing aids with a $500 allowance every 3 years using United Healthcare Hearing. One of the programs included with your plan is coverage for diabetic testing and monitoring supplies. These supplies, such as lancets, lancing devices, glucose control solutions, and meter replacement batteries, are covered at a $0 copay when you use OneTouch and Accu-Check approved systems. If you're not using OneTouch or Accu-Check, please check with your provider to see if one of the systems will work for you. A temporary supply of your current brand can be requested while you work with your provider to switch to one of the approved systems, and it may require you to get a new prescription. Within your Medicare Advantage plan, you do have 24/7 access to virtual doctor's visits. If you're home and experience symptoms such as a stuffy nose, allergies, bronchitis, pink eye, or flu-like symptoms, you can contact a doctor 24 hours a day, 7 days a week using a telephone, tablet, or a computer. A doctor is always available to answer any medical-related questions. You can receive a diagnosis or even have a medication prescribed and sent to your pharmacy. Virtual behavioral health visits are also included in the plan and are covered at a $10 copay when accessing this benefit through either Amwell and Doctors on Demand. You would never be asked to provide a payment for the service. For 2025, Teladoc will now allow you to complete a one-time telephonic enrollment, and you can request a callback or even schedule an appointment. United Healthcare House Calls is a yearly in-home visit to help stay on top of your health between regular doctor's visits. A United Healthcare House Call visit is a no-cost checkup from one of our healthcare practitioners that lasts for 1 hour. At your visit, a member of our licensed medical staff will review your health history and current medications. They will perform a head-to-toe exam, basic health screening, and help you identify any health risk in your environment. They will talk to you about any health concerns you may have and even connect you to resources to assist. It's really a great opportunity to ask questions you may not have had a chance to address with your doctor. You will even receive a personalized checklist of topics you may want to discuss with your doctor, and a summary of visit will be sent to you and your regular primary care provider. And if you prefer a video visit using a computer, tablet, or smartphone to connect the plan members with a healthcare practitioner, they'll review your health history and current medications, discuss important health screenings, and identify health risks and provide health education. Let's Move by United Healthcare is here to help keep your mind, body, and social life active. Let's Move by United Healthcare provides resources, tools, fun events, and personalized support to help you explore ways to eat well, get fit, beat the blues, and stay connected. There are tasty recipes, fun cooking events, at-home workouts, and fitness events at participating gyms. Let's Beat the Blues provides support services, online tools, and resources to help you make the most and take the time to take care of you. Stay connected, make friends through local and online classes, volunteering, and more. United Healthcare's Healthy at Home provides you support that goes beyond traditional medical care to successfully recover at home. You are eligible for Healthy at Home benefits during the first 30 days following all inpatient and skilled nursing facility stays. Your additional benefit includes 28 home delivered meals when referred by United Healthcare engagement specialists, 12 additional one-way rides to medically related appointments and to pharmacy trips, and 6 additional hours of non-medical personal care provided through a CareLinks professional caregiver to perform tasks such as preparing meals, laundry assistance, medication reminders, and more. And if you still want to learn more, you can visit us at TRS-Care Medicare Advantage Plan Virtual Education Center to continue to explore. You will learn more about the custom programs available to you, watch videos from real-life United Healthcare members who share their personal stories of using several of the programs. You can access the Virtual Education Center from any tablet, computer, or smartphone. Now let's talk about what you can expect next from your United Healthcare TRS Medicare Advantage. After your enrollment into the plan, you'll receive in the mail your United Healthcare Quick Start Guide. This gives you information on how your benefits work and includes your U card within 7 to 10 days after your enrollment is approved by Medicare. Once you receive your card, you can go to the same website, retiree.uhc.com, to register for your secure personal online account. When you register, you'll be able to review benefit information and plan materials, look up your latest claim information after we receive claims to process, print a temporary member ID, and request a new one if needed, search through a network for doctors, and sign up to get your explanation of benefits online. Start using your U card on your effective date. Soon after your effective date, United Healthcare will contact you to complete a short health survey and make sure you have everything you need to make the most of your plan. Throughout the year, we'll also provide reminders about preventive care, as well as offer programs and resources to help you live a healthier life. Thank you all for taking the time to learn about your United Healthcare with TRS Medicare Advantage through Take Your Retirement System of Texas. I'm now going to turn the presentation over to Express Scripts.
Well, thank you, Lacey. Hello, everyone. My name is Cartier Foster, and I'm with Express Scripts, the Prescription Drug Coverage Administrator for TRS-Care Medicare Rx. Today, I'll go over your prescription drug plan. So let's talk a little bit about our benefits. One thing I want you all to know about TRS-Care Medicare Rx is that it provides a good deal and richer benefit than what you would see on those individual or marketplace Part D plans. TRS-Care Medicare Rx has no large out-of-pocket costs for brand or specialty drugs. You will have flat copays with this plan. You will also have access to a very broad network of pharmacies, which includes all the large pharmacy chains such as CVS, Walgreens, Walmart, Target, HEB, and others. Another great aspect of the TRS-Care Medicare Rx benefit is a 90-day supply option through the Express Scripts home delivery service or retail pharmacies, which includes most pharmacies in the network. The one pharmacy excluded from the retail pharmacy network is Kroger. With that said, let's talk about your copays for a 31-day supply at a retail pharmacy. Our 31-day supplies at a retail pharmacy look like this. The generic copay is $5. Your preferred brand copay is $25. Your non-preferred brand copay is $50. And your specialty or high-cost tier is $50 as well. Note that the specialty high-cost tier medications are limited to a 31-day supply, and I'll give you a little more detail on that in our next slide. Now, let's talk about our 90-day supply copays. You can get these 90-day copays at those retail pharmacies I mentioned in the first slide, or you can get them through Express Scripts home delivery. The generic copay is $15. your preferred brand copay is $70, and your non-preferred brand copay is $125. Now again, those specialty or high-cost tier drugs are limited to a 31-day supply, and the largest driver behind that is to control waste. Many times when new prescriptions are issued, they're for a recent condition or the person is trying a new medication. So often these new medications can come with side effects. For example, itchy skin or headaches. And you find out the medication won't work for you or your lifestyle. So what happens to the rest of that medication? It gets tossed in the trash. And often these are very expensive medications. So to control cost and keep premiums down, we limited the specialty high cost tier to a 31-day supply. All right, so now that we've talked about your copays a little bit, let's talk about the Medicare Part D drug payment stages. One of the big differences between the TRS-Care Medicare RX plan and a marketplace plan is your exposure to these different stages of the Medicare Part D process. With TRS-Care Medicare RX, in every stage of this process, you're going to pay your flat, predictable copay. So you already know the exact amount that will come out of your pocket. Let's talk about each of these stages, including the deductible stage, the initial coverage limit stage, and the catastrophic stage. During the deductible stage, in a marketplace plan, you will pay the first $590 out of your own pocket. With the TRS-Care Medicare RX plan, you do not have a deductible, so you can expect to pay your flat, predictable copays in this deductible stage. The next stage is the ICL, or the initial coverage limit stage. Well, starting in 2025, it is not applicable. All right. So the last stage is the catastrophic coverage, or the CAT stage. You get here after you incur $2,000 in out-of-pocket cost. For most people, your copays will go down here. With TRS-Care Medicare RX plan, you will continue to pay your flat, predictable copay, or $0 after meeting the $2,000 deductible. All right, so next, let's talk about a real world example looking at those Medicare Part D drug payment stages. And we chose Jakafi 10 milligrams, which is a widely used specialty medication on the TRS-Care Medicare RX plan. Now, the cost of this medication is $3,667.65 for a 31-day supply, specialty medication. Here's what would happen with the marketplace plan versus the TRS-Care Medicare RX plan. You can see in the deductible stage, in a marketplace plan, you would with TRS-Care Medicare RX, it would be just a $0 deductible. There is no or not a pharmacy deductible with this plan. So you will only pay your $50 copay, saving you $540. Now, the initial coverage limit is the same. In a marketplace plan, you would pay 25% of that medication cost until you reach $2,000 true out-of-pocket or TROOP. Instead, with the TRS-Care Medicare RX plan, no matter what stage you're in, you're going to pay your flat $50 per fill for the drug Jakafi, saving you over $700. Now, lastly, during the catastrophic stage, you can see that in a marketplace plan, the cost of the medication lowers to $0. This will be the same with TRS-Care Medicare RX because your $2,000 true out-of-pocket has been met. All right, so now let's discuss a little bit more about diabetic supply coverage. Your plan covers diabetic supplies in two ways, under Part B, as in boy, and under Part D, as in dog. Certain elements of diabetic supplies processed either under Medicare Part B, as in boy, or Part D, as in dog. Meters, lancets, and test strips fall under the Part B, as in boy coverage. So please present your United Healthcare card, that U card that Lacey spoke about, at the pharmacy when you fill these supplies to process them correctly under Part B, as in boy. Keep in mind, TRS-Care Medicare Advantage participants will not pay a copay for these supplies. Now, for needles, syringes, or anything used to administer insulin, these fall under Part D, as in dog, coverage. So please present your Express Scripts card at the pharmacy when you fill these supplies to process them correctly under Part D as in dog. Again, please take note that TRS-Care Medicare RX participants will not pay a copay for these supplies. All right. Now, one of the more important parts of joining TRS-Care Medicare RX is all the communications. This time of the year, you'll get a lot of communications from different providers and their plans. We want to make sure you know what's coming and that you know what's important, and you know what to pay attention to. So you may fall into one of these two parties. Either A, will you turn 65, become Medicare eligible, and join TRS-Care Medicare RX soon? Or B, you're already with TRS-Care Medicare RX, and you're just here for a refresher. Now, if you're turning 65 soon and joining us for the first time, you'll get a Turning 65 packet from TRS about 90 days before your 65th birthday month. It will contain your summary of benefits, a high-level overview of this plan. You'll get a welcome kit from Express Scripts within 10 days after CMS, Center for Medicare and Medicaid Services approval, which will have your critical ID card. And I just want to again share an important reminder. Please be sure to open and read anything you get from Express Scripts or TRS. Now, if you're already with TRS-Care Medicare RX and you're just here for that refresher, you can access and view your evidence of coverage, or EOC, at the Express Scripts participant website. Please also keep an eye out for EOC mailings. The evidence of coverage gives you a full explanation of your plan, and again, it's online at the Express Scripts participant website, but you may also request it via mail. Now, lastly, you will get an explanation of benefits, or EOB. So please note that for any month you fill a prescription, you'll get an EOB the next month. The EOB will tell you things like what you paid, what TRS paid, what Part D drug payment stage you're currently in, which TRS members don't have to worry about. But it also provides a summary of your month's prescription activity. Now, if you don't fill a prescription within a month, then you won't get an EOB. But please keep an eye out for your EOB a month after you fill a prescription. Before I move to my last slide, I want to point out, for those of you that are joining us soon, that you can only have one Part D as in dog plan at a time. If you have Part D as in dog coverage when you join TRS-Care Medicare RX, you will be disenrolled from the other plan. All right. So as we wrap up this presentation, I want to leave you with two really great features. The first is our Express Scripts website. It's a one-stop shop for all of your prescription management needs. You can print documents, expedite shipping, check your drug costs, and find a pharmacy in your area. You can download the Express Scripts website link in the handout section. Look for the handout called TRS-Care Medicare Advantage Important Contacts. Now, the second is our customer care team standing by for you 24 hours a day, 7 days a week. You can reach them at 1-844-863-5324. They are a dedicated team of customer service representatives, and they know your plan. So please reach out to them if you need any help with your TRS-Care Medicare RX plan. Now, we're going to transition back to TRS to wrap up this presentation and lead us in a question and answer session. But I want to thank everyone for listening. Thank you for your service as educators. We really appreciate your time today.